For Crema Media's Polity, I'm Sane Dlamini. Dr. Errol Holland joins me to discuss his book titled A Life of Color. Welcome, Doctor. And thank you for your time. How did it make you feel when you were not accepted at Vet University, but then you went back there to work afterwards?
Yes, you know, well, to be frank, I mean, I didn't deserve to be placed in medical school, you know, so unlike my brother, my older brother, who was always aspiring, a very diligent person, and he was scheduled to go to the University of Witwatersrand there. But on the first year he was accepted, he wasn't accepted by the university, but accepted and gave him a permit to study. The next year he was accepted at Wits, but not given a permit to study at Wits. And still to today I bear that sort of anger with me. So I'd known about those things. But when I got taken into medicine at UCT, to me it didn't matter, because I felt that this was now my life had been placed on a road to where something meaningful was going to happen in my life.
What is your comment on the current state of the health system in our country, if you compare it to what it was like in the apartheid regime's time?
You know, I think that we are still seeing the repercussions. I know we say we mustn't always refer to apartheid years, but unfortunately it has determined our status from the way we, even before we were born, of your status in utero, and how well you grew in utero, you know, under deprived circumstances. And, you know, it determines every single aspect of your life, the second-class schooling, and in some cases, very poor schooling, non-control, and therefore, the wastage of human potential is so huge. And the fall-off, as you know, I mean, a huge percentage of students are drop off, and only a few of them starting at school would really finish up with successful at university. And, you know, it is that type of all-encompassing social conditions which, unfortunately, has not been corrected, particularly for poor people. And we are still seeing the we and them, you know. And certainly there was this whole, in the past, in the apartheid past, it was, everything was meant to be the very best, in the very best hospitals for the privileged of the society. And whereas not only were there poor facilities for people of color, but, you know, people of color had this dreadful diseases which were preventable. It's the type of inequity of the circumstances and the facilities which was the hallmark of the apartheid regime. Now we are over 24 years post-democracy. And I would have expected, and this is, I have been fighting as a health activist for renewal of our society. And again, I feel betrayed in many sense, in the great concepts of the health facilities are still not really geared, it's not really comprehensive, targeting preventive health. There's still rubbish dumps in which children are getting sick. They're suffering from preventable diseases because of the conditions that haven't been addressed. They are still being, there's no health promotion and assisting people to live healthy lives. The actual medical facilities and the medical care is of second rate in our facilities, for deprived people, and those things are still the inequities are gross. Now, if you have money, it's now become a large economic thing. It becomes, if you've got the means to, then you can access better hotel facilities and whatever. But the inequities are still extremely stark, and still the majority of our children are dying from preventable disease. Preventable. Women are dying at childbirth, which we shouldn't be doing. And so that we now, 24 years post-democracy, have a huge way to go, and that's why I still am a health activist, striving for equity, justice, and for the entire systems under which we live, which doesn't only involve healthcare. The education, we should have, if to my mind as a revolutionary movement, we should have really made sure that the best schools are available for the poorest of the poor. To make sure that the schooling facilities looks like something like St. John's, which is really the ultimate, with the facilities for sporting, for recreation, for teaching, high-class teaching, high-class teachers, high-class facilities, to make those children aspire to the very best. We still have not addressed the situation in education. We still have the poorest of schools. Our teachers are not controlled. We don't have those wonderful facilities where the children can aspire to the very best and to be able to learn. And the teachers are, the facilities are not accredited. It's not decent. The teaching is not accredited. And those are the things that should have been there, starting right in the 3 years before schooling starts. And the facilities are still not available for the children to live a meaningful life beyond their real education. But worst of all, at this time, we still have students having to relieve themselves in the fields. We still regularly, for the last few years, every now and then, there's a little child drowning in a pit latrine, which is too ghastly for me. Look at me, if those were my children, how terrible I would have felt under those circumstances. And these are the things where it tells me that I feel betrayed again, that what I had been fighting for and really had, as a health activist, forsaking all my own type of enrichment and working in the public sector because I believed in the political solution, and yet 24 years later, we're still sitting in that situation, and therefore, a luta continua.
As an activist, do you support the National Health Insurance Scheme that is proposed by our government?
I actually do, because it is the bravest attempt to get equity. The National Health Insurance primarily is geared for the poorest of the poor. Those districts out in the rural and remote areas where they haven't seen a doctor. I've been working for the last 3 years, following on my stint in academia. I've been working with the Foundation for Professional Development, recruiting doctors for those rural and outlying districts. And so I've got direct information about the sad state of the facilities for people. Yes, the government has really created access to a primary level of care, which was never there before. I don't know what it be. People must have just died in the past. And that is the big advance, giving free health care to women and children. And putting facilities, accessing the system nearest to where they live. And the whole idea was that they would then be able to be referred to wherever is needed at a regional level or a central level. But the facilities are poor over there. There's staff shortages, there are drug shortages. And, but the wonderful thing about our people, and the sad thing on the same time, is that they've got such trust. And they are so grateful that there's now a doctor. And this is where the work that I've been doing since from the end of 2014 until this year, when our company that I was working for was the tender was stopped, and it was handed over to the provinces. But that's where I was working for the last 3 years, and I know that those people were so grateful that at least there was a doctor, even if it was for 1-2 days a week. And they used to come to those clinics where the doctors were placed. We couldn't have, I mean, providing and catering for maximally 142 doctors. It's not a drop in the ocean of what the needs are. But that is was the pilot programs that were set up. But the whole NHI was geared towards providing equity across and making sure there's equity of access, equity of the type of standards that people are treated with, making sure that people have access and facilities nearest their homes so that they prevent them from having to travel long distances to regional and even central hospitals. And so to make sure that those facilities will treat what is appropriate to treat at the primary healthcare level. And that is the thrust of it. And I fully support it. But there are problems. And those problems need to be addressed. But I just believe that it's a start, and which we should really be, all of us, should be making efforts to make sure that system works. You know, there's a whole sort of confrontation, you know, of the upper end schedule of society saying, this is what we have, this is poor for us, why must we enter facilities that are not at our standards, which we expect. We expect specialists to see us, and our children have illnesses that can be treated at a primary healthcare level. And the building up of the facilities to make them of a good standard, where people feel satisfied that they're getting the best of care, and that they're in facilities which they feel they are in a professional situation. That is a building situation which unfortunately we are competing for resources in the health sector, with the sources that are needed for education and for housing and for communication systems. All the things are unfortunately coming in at the same time. And therefore it is going to be a long, long battle to in fact get the NHI to where it should be, and to really realize the objectives and outcomes that was intended for it. And so until then, there's such a lot of contestation, and particularly coming from the private sector. And whereas it is the mandate of all facilities in the country to make sure that people all over have the best care, and that is the long-term dream, and I think everybody should support that. And we must work actively to sort the problems out.
And lastly, can you briefly tell us what the readers will get after reading your book?
Well, the message that I am all about is that I have learned such valuable lessons. I have been extremely fortunate in this life to have got where I've got through all the difficulties and problems. And I was, the fortunes had with me in the serendipitous way. I did things, but I got to a situation where I had reached the top of my field, and I acquired a PhD in research, and all through the fact of serendipity and extreme fortune that I had experienced in my life. But along the way, I had such unique experiences along the road, which in fact emphasizes in my mind the various lessons we must learn about life, how we must care for each other, what the ethos should be for, and the fight for justice and equity through those means. And those are the lessons. I don't have solutions, but I am hoping that I'll be able to motivate not only people in this country, but in the global community of peace-loving world and global citizens, for us to rise up to our historical obligations to get the world correct, and to make sure that we do every effort, no matter where you are, what your station is like, to contribute to that. Because until the poorest of the poor are freed and being able to given that platform and opportunity to improve their lives, and for their lives to be improved, and for them to stop the wastage, stop the death from preventable diseases, create the correct conditions where people can live worthy lives, and for our aspirations of our children to soar. And that is what I believe we should all be doing to motivating for a better life for everybody.
Thank you, Doctor. That was Dr. Errol Holland speaking to Polity about his book titled A Life of Color.